we'll be discussing deaths from organic solvents. So it's basically the organic solvents, they basically include the volatile substances, and that are going to be discussed over here. These are usually the drugs of abuse. So the normal characteristics of any drug of abuse are present in cases of the autopsy findings. For example, there will be signs of self-neglect, and if the person is alive and in an intoxicated state, then he may basically have an altered sense of consciousness, and that will basically result from alcohol intoxication, and that can also be a result of many other drugs of abuse that are commonly being used, and even these organic solvents that are commonly being used, and they're commonly being abused by a lot of people. So these intoxications are quite common, and so we'll be discussing them over here in this section. Now, what are the medico-legal importances when we are discussing these organic solvents? It can be of a homicidal, of a suicidal, and it can rarely be of the accidental intent in cases of children or in cases of the old age people, which may confuse substances to different substances. So these are basically can be the causes or can be the medico-legal importances when we are talking about these organic solvents. Now, the dangers of the solvent abuse. This is one thing that we're going to discuss over here. When someone is abusing these solvents as the drugs of abuse, then what are the dangers of their intoxication? What can be the sign and symptoms in cases of these intoxications? That is discussed over here. The products that are commonly being the volatile products that are commonly being used as the drug of abuse, it can be petrol, that is gasoline, it can be xylene and benzene as well. Now, carbon tetrachloride poisoning is also one of the common poisoning that occurs in a lot of cases, and it has its own significance, and that we'll be discussing over here. Now, the volatile substance abuse. It's quite common, the alcoholic intoxication through euphoria. So it's basically that euphoric effect that you get after the intoxication that is going to compel the person for the abuse of such drugs. The hallucinations is one of the factors that adds on to the euphoric factor. Now, the metabolism is shown over here. The ethanol in the presence of the ADH and the ALDH, it is converted into acetate, and it is then in the peripheral tissues, it combines with the basically this reaction, the water and carbon dioxide, it takes place. So the flushing, nausea, headache, and general discomfort is observed initially. Then there is this phase of lactic acidosis, ketoacidosis, and increased triglyceride formation, and then we have that muscular weakness or the muscular incoordination symptoms. So these are basically the symptoms or the stages of the alcoholic intoxication that are being observed accordingly depending upon the metabolic reactions that are taking place. So the substance of abuse are usually placed in a plastic bag. So it is a common observation that is observed. The sensitization of the myocardium is another feature that is observed in these cases of volatile substance abuse. Now, the dangers of the solvent abuse are quite common. So sudden death is one of the complications that can occur. The cardiac arrest following arrhythmia is one of the symptoms that is being observed over here. And then we have the myocardium sensitization. So we'll have a sensitized myocardium, and that is one of the features that is observed over here. The precipitation of the ventricular fibrillation. So again, there will be changes at the ECG level. There will be arrhythmias, ventricular fibrillations will be observed in these cases. Now, at autopsy, what are the findings or what are the peculiar findings that are basically going to distinguish a case of solvent abuse? There'll be a diffuse interstitial myocarditis, and there'll be a minimal myofibril necrosis. So these are the complications that are observed in these cases of solvent abuse. Talking about the chemical effects of the solvent abuse, the erotic hypoxia and hypercapnia is one of the chemical effects that is taking place after this solvent abuse. The death from the plastic bag asphyxia is one of the factors. There will be a hallucinogenic effect and the potent risk of vomiting, nauseating phase. Then there will be a vomiting phase that is going to be observed in such cases. Then we'll have the agonal regurgitation. So as well as if we can basically couple it with the vomiting effect, there'll be a phase of regurgitation as well. And then we'll have the ventricular fibrillation, or we can have the cases of the arrhythmias being observed in these cases of these which we are talking about, the alcohol abuse. Now, the physical dangers and the refrigerator effects are again one of the complications that are being observed in the long-term users. The pharyngeal-laryngeal areas are observed in these cases, and there will be reflex cardiac arrest in such cases. The effects of the palate and the pharynx as well as the larynx are also observed. There are dangers to long-term users, and one of the dangers is the liver damage. So the metabolism is taking place in the liver and the kidneys. So these are the primary organs that are damaged over here in the it can also be a fatty change in the liver in cases of the chronic abusers, and it can be the renal damage as well. So these are the these are the organs that are taking part in the metabolism of such substances, and so these organs are going to be damaged subsequently. Substances that are commonly being used in the abuse are toluene. So toluene is one of the substances being abused, and the chronic intoxication is quite common in cases of toluene poisoning. Then we'll have drunkenness, mental confusion, and coma is also observed in these cases of toluene poisoning. The brain damage is one of the feature over here, and that is quite significant and quite frequently observed. Then we have the long-term abusers. So what are the signs and symptoms in the long-term abusers? We have the electroencephalographic changes, we have the encephalopathies, and we have the cerebral atrophies. So these are all being observed over here. Talking about the xylene poisoning, it's basically causing the swelling and the wrinkling of the skin. Non-vital acanthylosis. So these are basically the skin changes that are taking place. We'll have a hyperkeratotic skin, and that is going to come along with the acanthylosis. In cases of the gasoline poisoning, we have the circular impressions on the face, and the blistering and the peeling of the skin is also observed in such cases of gasoline. Talking about the benzene, we have the bone marrow depression as well as the fatal aplastic anemia. So these are the characteristic findings being observed over here. We have the dichloromethane and the 1,2-dichloroethane that basically precipitates in painter strippers, and several accidental dichloromethane fatalities occur in such cases. Then the butane and the propane are also being misused, the upper fractions of the oil distillation, and they have the negative effects. We have the fluorocarbons that basically affect the euphoric and the hallucinatory effects, as well as the myocardium sensitization, and the sudden deaths are observed in such cases. Talking about the subject that is carbon tetrachloride, it is quite toxic. Suicidal and solvent abuse is one of the aspects to the medical legal aspects. There is liver damage, centrilobular necrosis, total acute yellow atrophies, and renal damage are the characteristics to it. And tubular necrosis is one of the factors that is observed over here. And then we have the autopsy on the fatal solvent abuse victims. So it is strenuous and vigorous resuscitation is observed. Paraphenarrhea of sniffing, examination of clothing, skin lesions are crusted in appearance. There are histological examinations, aspirate air from trachea, ligature around the hilum of the lung. So in this section, basically, we dealt with the organic solvents, and specifically, we discussed the carbon tetrachloride and how are we going to diagnose such cases of the carbon tetrachloride poisoning. That is discussed over here. That is the end of this section. Thank you for watching sqadia.com.